Good morning, everyone. Hope you're having a great week so far. Dr. Z here with yet another episode of Tooth Teacher Tuesday. This week, continuing our trend of talking about different ways to replace teeth that are missing. We've already talked about removable options, and so there's two other options typically for replacing missing teeth. And the second option is what we'll talk about today, and those are dental bridges. And dental bridge, you know, the name kind of explains itself, but you think of a bridge as something that connects a gap between two spaces, whether that be, some kind of river or valley or what have you. Same thing with the dental bridge. Dental bridge is going to replace a gap between two teeth. So to kind of give you an example scenario, I've got my models again, and essentially what a dental bridge is, we've talked at length in the past about crowns. Crown is just a basically covering or cap over top of a tooth. So when we crown a tooth, basically we make some clearance on the top and the sides of the teeth so that it's just a smaller version of itself, and then the crown gets cemented over top of it like that, and you've got a tooth again. With a bridge, same idea, except we make that same clearance on two teeth that are on either side of a gap, and then crown those teeth, but then they're connected in the middle by a fake tooth, like you'll see here. So our two neighboring teeth there, that bridge goes on, and now we've got a replacement tooth there. And so these three teeth are connected or fused together. And that's the basics of a bridge. Now, kind of the good and bad and limitations with bridges is, since these three teeth are fused, you can't floss directly in between them. You have to either floss underneath the bridge or get some kind of water flosser that will clean under the bridge. So maintenance is a little tricky. But the good thing with the bridge is it is cemented, it is permanent, so you don't have to worry about taking it in and out like the removable options we talked about. The limitations with bridges, though, is, as we said, a bridge is going to connect 2 points, close a gap between 2 points. But if we've got a situation like this where we've got a gap and there's not a tooth on either side, we can't do a bridge because there's no anchor back here. And trying to do a bridge without anchors on both sides, I kind of explained to patients like this, it's rather than being a bridge, it's more of a kind of like a diving board. Have a diving board effect where this is just going to have a lot of rock and torque because there's nothing supporting it on the back end, and eventually that torquing over time is going to cause the bridge to come off or cause damage to this tooth. All around, just bad deal. So bridges do kind of come with a caveat that we have to have teeth on either side, which isn't always the case. Sometimes it's the very back tooth that's missing. So in closing, bridges, they're a great option for someone who maybe isn't a good candidate for an implant, but also doesn't want something removable like we talked about before. They're a great option. Bridges work very well. They just come with that limitation that we can't always use them to replace teeth. And they also, while it's nice that they're permanent, they also are a little bit inconvenient trying to clean around them. So that's option number 2 when it comes to replacing teeth, if you've been following along. Last option we'll talk about here in a couple weeks are dental implants, which are becoming more and more common and popular. So I hope you will tune in for that. In the meantime, thank you for your time, and I hope you have a great week.